You may or may not be aware of this, but this is a simple concept. Brushing and flossing, scaling and root planing do not kill pathogens. Period. Pathogens can kill us, but brushing and flossing does not kill pathogens. Scaling and root planing doesn't kill pathogens. Is that important to you? Is that relevant information? If you know that, is there something you want to do with that? Is there something you want to do about it? Currently, no matter where you are, there's relevant social media, magazine information relative to oral systemic health, the connection between our mouth and our body. 2017 Men's Journal advising its readership. 2016, and I've seen it almost every month, some Facebook posting advising your friends in Facebook that there is a connection, it is important, you should be concerned. Researchers know what you're about to hear. Researchers think that oral bacteria can get and travel infect tissues throughout the body and can become a significant health concern. Dentistry knows that there's a connection between oral pathogens and systemic health. Very few of us have elected to do something that actually is different than what we've always done. The line where the concentration of bacteria is so much that the body, your immune system, my immune system, cannot mitigate the pathogen load. Where does it go if it can't be held and or supervised in our mouth? Huh? Goes anywhere it wants. There's a lot in your lap. And so when that patient is in your lap, do we want to be talking about the cat and the dog and the pet and the kids and the college? Yeah, sure. But do we want to be talking about their health? How are you feeling? What's your A1C? You know, high blood pressure is a little high. And all of a sudden, when you understand everything that affects pathogen counts in their mouth, can be mitigated by lifestyle choices. Incredible, powerful information. All of a sudden, your conversations change to keeping their heart healthy to how the kid's doing. So 2017, what are we doing? Not what do we know, but what are we doing to make that difference? Because we know now genetically she can't fight bugs, she's on a 2-month recall. Anybody who is genetically high will never tolerate a 3-month recall and be successful. It's 2 months. 2 months. I'm not here to sell dental hygiene production to your practice. Money is not important. Revenue is not that important. You got to pay the bills. But all of a sudden, when you understand what you need to do to keep people healthy, something happens to the hygiene department in every practice that engages in this process. And this is like showing a patient an intraoral camera view of a broken tooth. Mrs. Jones, Mrs. Mary, well, these are the bugs that you have. Those are the bugs that are involved in cardiac events. They don't want them. They don't care how much it costs. We have better and better insurance coverage of these things, but they don't want them. Please get rid of them. How much does it cost? When can we get started? That's the real deal. Periodontal pathogens. High-risk pathogens in high-risk patients are an accident waiting to happen. And each and every one of you have the opportunity to supervise that, to look at that every single day of your life, or every single day you're in the office with your patients. The landscape has changed. It's not mechanical debridement as we used to know it. It's not scaling and root planing as you used to do it. It is no longer foundational to not only periodontal health, but now, as you'll learn in the next few minutes, systemic health. We're well-intended professionals. We know a lot, we think. We've taken for granted that maybe science has changed the landscape. And in fact, it has. I'll never, the thing that pushed me into more discovery related to pathogens, I was sitting in the office here in Cadillac, and I believe, Tracy, it was you who came in and said, remember that patient that we did the 10 extractions for? It was referred to by a cardiologist. The cardiologist was going to do some cardiovascular surgery. He knew, and he was a new patient to our practice, but he knew that we did some, we had some concern about oral systemic health, which we had some concern. Okay, we had concern, we knew, but we weren't really doing much about it, just like probably most of you. And so, well, Tracy says, well, he was in for his extractions. He had everything went fine. His wife called back the next day. Oh, he loves you. He never felt a thing. You know, you've all heard this. They think you're the best thing next to mashed potatoes. So a week later, his wife calls, said, I need to cancel all his appointments. He just died of a heart attack yesterday. Well, I hadn't heard the statistics that within 4 weeks of any invasive dental procedure, the rate of cardiovascular events go up. Cardiologists and I had decided we would do 4 amoxicillins and then go because we were really going to be safe. Had no concept of dormant pathogens. Wasn't doing the guy a darn bit of good. So that struck a chord. I had just thrown something in a wastebasket about an oral systemic presentation in Traverse City. It was a real short one by Whit Wilkerson from the Dawson Institute. I went to that because of that incident. So I get back from the first, I'm doing this. And I walk into the treatment room for a recall examination for Mrs. Cooper. Names change, it's different. Mrs. Cooper comes in every 3 months, and she usually comes in with her husband, who, by the way, is Dr. Cooper, who just retired, and it's a Cadillac physician and his wife. And Mrs. Cooper, good to see you, and how's everything feeling, and how's Dr. Cooper doing? And there was a pause, and she kind of stopped and looked me in the eye and says, you know, you probably didn't hear, Dr. Cooper died of a heart attack. And I'll never forget the experience. I'll never forget when, because every time I come to see you guys, I'm reminded of his passing. It was 1 week after he had his teeth cleaned last time. They had a heart attack. Now I already read about the incidence of cardiovascular events after scaling, root planing, and any or dental invasive procedure. So that was the knife in the heart of John to say, I need to not only know more, I need to share more. I'm at the point in my profession where I don't need to prove anything to anybody. I don't need to do one more full mouth construction. I don't need to do one more smile makeover. Done them, still do them. But that is not as significant as what I'm sharing with you today. Saving a life, extending a life, giving patient another degree of wellness because we took care of pathogens in the right way, in the right time, that makes a difference.